Do you know that one of the things that can badly affect proper medical diagnosis involves people not having the right information? And when I say this, I'm not just limiting it to a particular set of people. No, it cuts across everybody, both the patients and the caregivers themselves. And when this type of thing is allowed to stand, it creates a situation whereby two persons are going in the same direction, but they are still maintaining a distance. Both the patient and the health caregiver are trying to establish a diagnosis, but they are being kept miles apart. And just the other week, we had this man that brought a urine sample that was collected in a roughly capped container like this one. And this sample is meant for urine culture. When we looked at it and said, look, we are going to recollect this sample, it became a problem. This man became very annoyed. He couldn't just understand how repeating the sample collection could change anything about anything. And that was the problem. But come to think of it, why do we insist on working with a particular type of urine sample in the laboratory? Why? Isn't that a way of stressing people out? I mean, some of these people are already going through a lot, and then telling them all those things has a way of adding to the problem already. Some will argue that, okay, urine is urine, and whatever thing that is inside can be seen by anybody and anywhere, it can be verified by anybody. But what they have forgotten is that actually urine is urine, but the content can differ depending on how it is collected, when it is collected, and what is used in collecting it. And that alone can change a whole lot of things on the result you're going to get thereafter if you use that particular sample to work with. And so I think it's good for all of us that are involved to sit back and look at all those things that will cause your urine to be unsuitable for culture. And this is a video you should pay very good attention to so that you don't keep repeating these mistakes because they are very costly. For those of you who are new to the channel, please, you just have one thing to do. Subscribe to the channel and then keep your notification button on so that everything we have here will be yours. Now, let's get into it in details. One of the things that can make your urine very unsuitable for urine culture is random collection of sample. Random here, I mean that you start collecting your sample anyhow without following any guidelines from the laboratory. Now, every laboratory has a principle. There's what is called standard operating procedures for every laboratory. And this is what they use to guide a patient starting from the time you are collecting the sample to every other thing they are going to do with such sample. And the idea is to make sure that whatever result you are going to get from that will be as accurate as possible. Now, you just on your own picked up a container from your house or from anywhere you find it, and then you pee inside and bring it to the laboratory for them to work with. It may not work, and that's not because anybody is trying to be wicked. No, it's because if you are not properly guided in this type of thing, external bacteria can be introduced into that sample during the collection time, especially when the genital area is not properly washed. And so, while this type of thing can be allowed to stand for some quick urinalysis or some other urine test, it is not recommended you allow it to happen for urine culture. The reason is simple. If you allow this type of contamination to take place, the lab may end up identifying some harmless bacteria on the skin or the surrounding regions instead of identifying the disease-causing one. Secondly, your urine can be considered unsuitable for culture if you collect it in a non-sterile container. So when I mean sterile container, it means that the container is free from all those microorganisms, from any living thing at all that are capable of contaminating the urine sample. You see, some people just want to collect their urine in a container or bottle they have at home out of convenience or whatever reason they might have. But that alone can change a whole lot of things, because if you allow that to happen, that may introduce an impediment or a contaminant that can either inflate or limit bacterial growth. And at the end of the day, the lab may find it difficult to establish accurate diagnosis using that particular sample. And even when you collect it in a sterile container and you don't send it to the laboratory immediately, it may be considered unsuitable or rejected outrightly. Now, urine for culture is supposed to be collected and sent to the lab immediately after collection. But if for whatever reason you are not able to do that, it is recommended that you keep it refrigerated. The reason is this: if you leave the urine at room temperature for hours or longer than that, it will give room for bacteria to multiply rapidly and then make it difficult for the laboratory staff to identify the amount that is actually causing the problem in the person whose sample is being analyzed. And again, if you allow urine to stand at room temperature for a longer period of time, it will lead to some chemical changes which can make the urine either more alkaline or more acidic. All these things will add up together to give you an erroneous result, which is not what you bargained for at all. Now, let me tell you a secret. Do you know that if you have started taking antibiotics, it is not advised you go for urine infection test at that time until you are done with that? You see, it's only on this channel that we go out of the way to educate you on all these things so that you don't keep making these mistakes. Now, tell me, what's still holding you from subscribing to the channel? If antibiotics have been started before collecting the sample for urine culture, it will eliminate or limit the bacterial growth even before the laboratory has a chance to identify them. And so what will happen is that this will lead to a situation whereby you will get false negative urine culture results even though the infectious bacteria is still in them. So it's advised that as much as possible, if you want to go for urine infection screening, that you collect the sample and send to the lab even before the first dose of antibiotic is initiated, unless your doctor advises you otherwise. Now, having said this, the next question would be, which one then is the acceptable one? It is called clean catch midstream urine sample, and this has been the gold standard because this has shown to provide a balance between accuracy, convenience, and lower risk of contamination. Now, don't get it twisted. I'm going to break it down so that you understand it better. When I say clean catch, it means that before collecting the sample, you are supposed to wash the genital area properly so that there won't be any contamination from the bacteria around the region. And then, if I say midstream, it means that while collecting the sample, you're supposed to allow the first part of the urine to flow out into the toilet. Then you collect the middle portion into a sterile container and then allow the rest to flow into the toilet. And this is to ensure that the urine you're collecting is coming directly from the bladder without all the contaminating things or the debris in the urethra that can make it unsuitable for what you want to use it for. But then some people will ask, when is the best time to collect this urine sample? For most urine infection testing, early morning urine has proven to be a better one because they give a better concentration of the bacteria in the urine sample and at the same time reducing the effects of dilution. But then there are cases whereby you may not be able to stick to this kind of restriction, especially for children and those on catheter. And we are saying that in those instances, urine can be collected at any other time of the day, provided that this urine is held for at least an hour before the time of collection, and that cleanliness is maintained, especially as regards washing the genital area before collecting this sample. Basically, what we are trying to say is that this thing is just like a garbage in, garbage out thing. Whatever you give to the lab is what they are going to work with and give you back the results. Imagine a situation whereby you give them a sample that is collected without following the guidelines as to maintain accuracy and convenience. At the end of the day, they may analyze that and give you a result that doesn't represent what you are dealing with. And that's why we are trying to make this video to educate you so that you don't make such mistakes. And now that you have known this, it's important you share this video so that many other people can get to watch this and avoid that kind of mistake. By next weekend, we're going to tell you all the things that can cause kidney stone and every other thing you need to know about kidney stone. So ensure you don't miss that video for anything. And thank you so much for watching. I hope to see you in the next.